In your understanding, it's just an erection. Actually, the penis is a muscle. No, that's a twist. First, arousal happens in your mind, then there's a release of nitric oxide, interaction with guanosine, and fourth, the muscle relaxes, and only then does blood fill the area, resulting in an erection. Today we're going to talk about a topic like erection, because recently I visited a forum and read some information that an erection, in general, the penis is a muscle, and getting an erection is very simple. So I was honestly surprised that people don't understand how the process of erection actually works and what it depends on. In your understanding, it's just a hard-on, but that's not the case. Let's imagine that the penis is like a sponge that's covered with a condom, right? And everyone has their own sponge, bigger or smaller, wider, thicker or longer. So anatomically, it's unique for each person. And this sponge is made up of cavernous bodies. The size of the cavernous bodies, it can also vary. That's what determines the size of the penis. These cavernous bodies fill with blood, which is what causes the process of erection, the engorgement with blood. And as a result, you see your penis become erect. All these processes happen in several stages because look, there are 5 steps that occur during an erection. First, arousal happens in the brain and nitric oxide is released. Third, guanosine is activated. Fourth, as a result, the muscles at the base of the penis relax. And only after that does blood fill the corpora cavernosa, which causes an erection. In other words, in very simple terms, the muscles at the base of the penis need to relax. The muscles relax under the influence of cyclic guanosine. And cyclic guanosine appears as a result of nitric oxide and regular guanosine reacting together. As a result, these muscles relax and a large amount of blood flows into the penis. After that, the muscles responsible for restricting outflow contract when a man is aroused, and this is what maintains the erection. When a man ejaculates or reaches orgasm, a signal is sent back to the brain indicating that the muscles at the base of the penis should relax, because if they do not relax, the blood will not go anywhere. But the vessels dilate, which causes the blood to leave the penis, and your erection disappears. This happens after every sexual act when you have ejaculated, finished, and so on. All the drugs that are commonly known as Viagra, sildenafil, tadalafil, these are the active ingredients in these pills. They act both on the arousal factor in the brain as well as on the muscles and on all these nitric oxides and guanosine. That's why all these pills that cause an erection have only a temporary effect. They do not treat the cause of the lack of erection, they simply induce it. Then it goes away. As soon as you stop taking the drugs that induce an erection, everything goes back to the way it was. There is no erection, and you're left with the problem that brings you to the urologist. So, in simple terms, I've tried to explain to you what an erection is. The penis is not some kind of muscle. It's made up of cavernous bodies that simply fill with blood. But how do they fill with blood? How much does the muscle that allows this relax? How much are hormones released? How aroused is the man? It all depends on the individual. Men, don't self-medicate. If you need a proper consultation with a urologist, you can contact me. The link will be in the description below. Write to me in direct messages, or there's a phone number listed there as well, which I always provide for consultations. I'll consult you and tell you what to do. Once again, I tried to explain everything in simple terms. I hope I managed to do that. Don't read obscure forums with questionable information from people who have never studied this. And again, don't self-medicate. So have a great evening, everyone. Leave your likes, comments, and subscribe to the channel so you don't miss the next video. And goodbye to all of you.